course, now we have Dr. Taqi Azam with us. Assalamu alaikum, Dr. Saab.
Waalaikum.
Sir, we are very happy to have you on APPNA Talks with TV1. So, sir, please give us your brief introduction.
Sure. My name is Dr. Taqi Azam, and I am trained as an internal medicine physician. And now my main focus of practice is wellness and longevity medicine.
Sir, how long have you been associated with APPNA organization?
Yeah, so my association with APPNA has been quite a while. I started in 2005.
Right.
And since then, I have been working with APPNA on different positions. And this is again a great organization to serve APPNA physicians and their families to get together, have a nice social time, entertainment, and a lot of other opportunities.
Sir, what do you think nowadays physicians are facing? What kind of challenges?
Yes, so that is a great question, by the way. As physicians are doing their job and they are really burning out in terms of getting tired of their job stress. So they're really huge burnout rate in the physician.
Right.
And that include the long hours, extra responsibilities, patient management and everything. So my focus is helping my physician friends, so how to age healthy and focus themselves as well, not only the patients.
Okay. And what is your general opinion on longevity?
Yes, so longevity is something, a new concept in medicine.
Yes.
And it just came 5 years ago. What it means that we believe that aging doesn't have to be diseased or sick.
Right.
We can be aging without having to gain disease and sickness. So how to do that? So that is what I retrain myself in functional medicine, anti-aging medicine, where we help people how to optimize their nutrition, how to do your exercise, and how to prioritize your sleep, how to take care of your gut health, and how to de-stress yourself. Because stress is the main culprit of all the disease and sickness.
Right. So how do you help your patients with wellness and well-being of themselves?
So we have different type of programs. When patient comes to us, if they have already a lot of disease burden, high blood pressure, diabetes, cholesterol, those are the three big ones. So these are food-borne disease.
Right.
So we start working to reverse those chronic disease and then bring them to not to have diabetes, blood pressure or cholesterol.
आप workshops या trainings करा रहे हैं young physicians को in the specialization you have done?
Yes, so that is what I have a lot of visiting, students and visiting young physicians. I am helping them train in this field.
Yes.
But they first have to go through the medical school, residency, and their training,
Because
and
if
then
I'm
they'll
not
come.
wrong, this field is relatively new,
Yes,
right?
it is a new concept.
Yes.
Absolutely. So that is why we are going to work to educate our physicians and younger physicians
Yes.
that you can choose this pathway
Yeah.
to become a different type of physician,
Right.
where you focus on health, wellness, and well-being than finding disease.
Thank you so much, Dr.
It was
Saab.
pleasure being here.
It
I'm
was,
glad to
it
do
was
that.
our pleasure and honor to have you on our show. Thank you so
no
much,
problem.
Dr. Saab.
Thank you.